A picture for us of where we're at in contact tracing right now, and kind of describe some of the clusters that you're finding, whether it's based on municipality or based on something like nursing home settings or other congregate care settings.
Thank you for that. So what we are seeing with our cases continues to be widespread community transmission. That is the primary driver. It's why we continue to hone in on informal settings, indoors, inconsistent groups. If you eliminate those three I's, that significantly decreases the risk of transmission. Outside of that community spread, in some of the other settings, because the increase in the community is occurring, we are seeing increases in congregate settings and some of the other settings where there is more structure in place. So they are not the drivers of clusters or infection, but can be the result of it because of the increase in community spread. That's the overall landscape that we have.
There was an article this morning that Massachusetts is having some significant problems with their contact tracing mechanics. How do we stand compared to our neighboring states? I know that it was certainly a problem here in Rhode Island for a while. Have we caught up? Are we feeling like we're back into a good position with that?
Yes, there are a number of answers to that. With credit to our team, we've done a great job in reducing the backlog that exists, but we've also come up with more innovative technologically supported approaches. Part of that includes the messaging that we've shared here. The majority of people, once we call them, actually know that they are positive, they're familiar with who their contacts are. We want to make sure people aren't waiting for us. They are taking action. First, accessing the testing that's available. Second, as soon as you are identified as positive, making sure that you begin isolating yourself and that you call your contacts and let them know. Call your place of employment, call your school environment, and let them know. As we're getting through this, more and more individuals are familiar with what they need to do and the importance of being able to stay home. That shared responsibility is also allowing us to keep our hands wrapped around the case investigation contact tracing response. We're including technology and texting people and informing them, allowing people to provide information to us about who their contacts are. These are the ways that we can go forward in addressing the response more creatively.
Is the state contemplating any actions against the gyms that are flaunting the orders to close?
I'm sorry, you have to repeat that.
Is the state contemplating any actions against the gyms and other establishments that are flaunting orders to close?
Yeah, I'm going to let the Commerce Secretary answer that because we are deeply in the middle of this.
Yes, we have a system of progressive leaning in to businesses that are either unknowingly breaking the rules or are doing something more flagrant. So first, of course, we communicate with the business. We want to make sure that our policies are understood, and most commonly what occurs is the business is not fully aware or thought that they were under an exception that doesn't exist, and they immediately remedy. So that's the most common case, and it has happened a number of times during the pause. The second thing that happens is that if they clearly are in violation, there'll be an inspection or at least an observation as to whether they're open when they ought not be, and there is a compliance order or what's called an immediate compliance order that's issued. And we are in the process of issuing some immediate compliance orders. If there is still non-compliance thereafter, there are remedies that can be sought from a legal perspective, and we hope not to have to reach that point, but that could occur. and there are cases where that's possible.
Mr. Pryor,
Governor, what do you think?
It's been reported in conversations that literally as we speak, the state of Rhode Island is engaged in an ex parte hearing, I believe in State Superior Court, with the proprietors of Max Fitness of Warren and Lincoln, Rhode Island. The crux of the case, from at least conversations with the business owners, seems to be the arbitrary and, as they contend, the capricious nature of the state to involve themselves in a consensual business relationship between a gym club member and the gym club owners, pointing out that at the same time they are, in the case of Lincoln, the only business closed in the Lincoln Mall. What is the state's strategy on this, and how far is the state willing to go if, in fact, this starts what happened, we discussed a few weeks ago in Michigan, a wildfire of businesses who, faced with extinction, simply refused to comply?
We have a set of rules that are in place. They are sensible rules that aim at restricting businesses and offering compensation for the revenue lost for closure. The governor has been exemplary among governors in offering that dual policy. So we think we've offered a very reasonable set of restrictions. I, least of all, want to see businesses restricted or closed. But public health officials have indicated which categories of businesses offer the greatest risk and for which closure offers the greatest benefit during the pause. So these businesses ought to close. There are very strong legal arguments that can and will be made pertaining to the public health authority of the state under those circumstances, and it is possible that under such circumstances as you describe, a temporary restraining order will be sought.
Governor, what do you think of these businesses openly defined?
At what point in time can business owners just allow themselves, in the case of this business, which clearly has an enormous amount of money invested, allow themselves to be placed involuntarily into extinction at the hands of a government who appears to be just picking and choosing arbitrarily? I mean, the only business closed in Lincoln Mall?
I question the premise in that the business might be at greater risk if there weren't compensation, but there is compensation being offered for the revenue lost. Therefore, this is one of the more fair programs in the entire country, indeed globally, as these restrictions have taken place.
Yeah, let me address this. And Brian said, what do I say? It's not arbitrary and capricious. It is in direct response to a public health emergency. Our hospitals are filled, people are dying, and I had to make difficult decisions in order to get the virus under control. Unlike Michigan, at the very same time I put the restrictions in place, we put $100 million out the door to compensate for lost revenue in this 2-week period. So Brian, what do I say to gym owners? I say follow the law. It is a law like any other law. I am sorry it's difficult. Please, sign up to get the compensation. Follow the law, do the right thing, and oh, by the way, if everyone does do that and obeys the pause, it'll only be 2 weeks, and we'll be able to open them.
You're almost halfway through the pause. Well, you're 4 days in, so
Yeah.
by the time anything potentially happens, what kind of message does this send to the other ones that are following the rules, and they're looking around and saying, why don't we just do this if we could have been open half the time?
Because if everybody doesn't follow the rules, then everybody will be shut down longer. That was exactly my point, which is I'm actually heartened that the early data suggests, by and large, people are following the rules. Mobility is down, bars are closing, most gym owners are just doing the right thing and closing. So if everyone does that, then it will only last 2 weeks. If everyone chooses to not do that, then we'll have to extend it more than 2 weeks. So listen, I know it's hard. I stand by the decision, and I need everyone to follow the rules.
The Governor, in Connecticut, from what we understand, the gyms are open. I'm told last night in North Attleboro, there's an Anytime Fitness. There was a line to get in, and the lot was filled with Rhode Island cars. So isn't it possible that because we're situated between those two states, that people will find a way, and it's younger people that tend to go to the gym as opposed to older, but it's easy to go to Seekonk, it's easy to go to Attleboro. It puts the gym owners on the line in a very tough spot.
I know that. And this, every decision I made, I've said from the beginning, it is imperfect. But I felt it was necessary, and for that 2-week period, those gyms on the border come and get compensation for your lost revenue. And for the young people, and you're right, it's mostly young people who continue to not follow the rules, I don't know what else to say other than to say they ought to be following the rules too, because people are going to get hurt if they don't. So, but basically, like, I know it isn't perfect. I think it was the right decision. I would do it again. And even though not everyone is complying, most are. We follow this. Most gyms are, most people are, most indoor sports facilities in Rhode Island are closed, and so that's a win.
Governor, just to your announcement at the very end of your remarks, what about, don't you feel responsibility to the country? If the leader of the free world asks you, this is an emergency, we need Gina Raimondo to step up, don't you feel some obligation to get involved in a new administration?
As I said, I've said what I've said. I have nothing more to say on that topic. I feel a massive obligation to the people of Rhode Island, and that's why I'm working so hard right now.
Governor, you have heard about and read about the anger surrounding funerals, specifically outdoors. And there's a story in the Journal. I heard from a guy today. His father is being buried with military honors on Monday. Mm-hmm. His family is big enough that some of his own children and all of his grandchildren are not going to be able to go. And with all due respect to the health department, the response is laughable. That an outdoor ceremony with a nuclear family is more of a problem than people going to church 25%, whatever the formula is. And so he's pleading with you. This happens Monday, just as you said for Thanksgiving. If you have a family of 10, if you have a family of 3, what is the problem with saying this family needs to be there? It's one time. I have a friend who's almost my age. She didn't get to go to her grandmother's funeral. She has never gotten over that, and it's been a lot of years.
Yeah, no, I hear you. First of all, here's what I say. These stories are truly heartbreaking, and as you can imagine, my phone lines and inbox are just overwhelmed with these heartbreaking stories of one kind or another. In that case, in the case of funerals, weddings, these once-in-a-lifetime events, we've been clear that we can make exceptions, and they ought to get in touch with us and tell us what you just said. These are the details. It's outside, and we'll see if we can let it go forward.
Outside, when you've said how many times? Outside is better. Outside is okay.
It is. Look, again, you always come to me with like the particular thing, and in that instance, if it is as you say, absolutely.
But it's also endemic of other people. It's one person, but this is going on.
So this is 2 weeks. There's only a very limited, thank God, a limited number of funerals and weddings in a 2-week period. And every one of them is invited to call us, and it's in the regulations. Exceptions will be made. So call us, call Commerce, call my office. We'll work with you. We will absolutely work with you. And if you give us assurance, it will be outside, we will follow the rules, we will be very humane, reasonable, and compassionate.
Just one other question. Across the street, there was a rally going on with the wedding industry people. I talked to you about this over the summer. You said, I'd love to get together with them, be creative. I know they've talked to Commerce. I understand you got the present. They are asking you to help save their 2021 season. So at some point, are you going to sit down? You got 720 members of this coalition who sat there. What is your message to them today?
Yeah, my message is I'm happy to sit down with them. The money we're just putting out now through the most recent round was specifically designed to include florists, photographers, all of those folks, makeup artists and the like, who are really suffering because of the lack of events. We went out of our way to design it so they could get some of that money. And I am wide open to anybody's ideas in any industry for how to make 21 even better than 19.
Governor, there is a significant outbreak of COVID at the ACI.
Yes.
The medical director of the DOC has resigned.
Yes.
What are you going to do? What is the state going to do to protect inmates and staff of the state prison system?
Yes. Thank you for asking that question. So first, you are correct. There is a significant outbreak in the maximum security at the ACI. We have 600 cases, and it's a serious situation. I will say we're doing everything we know how to do. The reality is that facility was not built with a public health pandemic in mind, which is to say there aren't even walls in between some inmates or rooms. So while that isn't an excuse, it is an extremely difficult environment in which to control an outbreak once somebody gets sick. What are we doing? We are all over it. We are all over it. We are testing every inmate on a regular basis. Every single inmate who gets sick gets a full medical evaluation. I think there's very few, 2 or 3, who are in the hospital. We're making sure they get excellent medical care, and we're doing the best we can to control the situation. Dr. Clark did resign. I would like to say I'm sad to see her go. She's fantastic. It's a really tough job, and I'm sad to see her go. It was a brutal job and a high burnout rate, and she did a fantastic job. We are, however, not missing a beat. Dr. Alexander Scott and her team are in there to make sure there's a transition, and we have doctors from the Department of Health managing that situation. Some people have said to me, hey, Gov, have you considered early release? Let me say this. First of all, I don't have the power to do that. Second of all, earlier in the pandemic, I did work with the courts to provide for limited early release for a few dozen people who were within 90 days of being released and who were nonviolent, low-level offenders. This is maximum security. These are serious crimes that people are there for, often violent crimes. So apart from the fact that I don't have the power to do it, no, I'm not inclined to do it. What I am inclined to do is work harder and harder every day. We put a congregate support team in there. We put one of our teams in there, just like we do in a nursing home, and we're trying to get our arms around the situation.
Governor, what's the state's plan to distribute vaccines to the inmates at the ACI? Is it something like other close contact settings like nursing homes? Are they included in the plan for vaccines?
Yeah, I'm going to let her take that.
So yes, we are in development of the details of the plan, but have high-risk populations like congregate settings in nursing homes, as well as the ACI, prioritized in terms of who we will be focusing on giving the vaccine to.
Doctor, nursing home cases are spiking again. The state's data shows cases are nearing springtime levels in nursing homes. What's being done differently this time around, or should we just expect the same that we saw in the spring?
What I shared earlier is that the fatality rate connected to congregate settings is significantly less, which is helpful and a reflection of what's been done differently over this time. We have been aggressive with cyclical testing. We've maintained that among all the staff. We've done it for the residents that are connected to an outbreak, and particularly now with the easier form of testing that's been shared, we are reinitiating the weekly regular cyclical testing of residents as well. As the governor mentioned, we continue to have the congregate setting support team. The staff is more familiar with the infection control measures that are needed. And as I shared earlier, now the additional treatments available, particularly the monoclonal antibody treatment, is one that we are looking to really prioritize our congregate setting populations to use.
Doctor, are there concerns about mental health issues during this pause, the isolation? What resources are available, or are you sort of prepared to handle an influx of mental health issues?
The mental health concerns have been a priority throughout this entire pandemic. The focus on connectedness that is so critical from an emotional wellness standpoint has been challenged when you have a pandemic novel virus such as this that requires the type of isolation to prevent spread. So we are able to leverage our Health and Human Services Secretariat and agencies, work closely with the Department of Behavioral Health, Developmental Disabilities, and hospitals, as well as our staff within public health, to really continue to build a response that is going to be a unique element that will continue probably long beyond the vaccination and the hopeful time that we have for the spring. So it absolutely is a focus during the pause, has been prior to, and will continue to be a focus for us to make sure resources are available and a key part of our response going forward.
Governor, there are states, and you've expressed your aversion to going toward a lockdown, but there are states that are moving in that direction. Is there a likelihood that's going to happen here?
I can. Sure. We have really assessed that in great detail. You know, I credit the governor. We're one of the few states in the region that have been thoughtful in being able to apply the pause that's in place. And our assessment of the data shows that the pause with a slow dial-up during the time afterwards can give us a similar impact to having the full-on shutdown while balancing the key components of commerce and the economy and overall public health that we know are critical. So Rhode Islanders can know that we've taken the most thoughtful, data-driven approach we can, taking into account how to best quell the virus and also protect, preserve the economy and overall public health for the long term.
There was a person who wrote earlier this week about that they use a gym for immunotherapy. I wrote to the health department to kind of get an answer, and the response was anybody who uses a gym for immunotherapy or therapeutics may do so based on whether it's a doctor's note or otherwise. How do you enforce these types of specific instances? You know, are you going to regulate gyms? Are you going to check? How do you manage through this pause when there's going to be person after person that has a specific reason why they should be able to do something that the population is supposed to not be doing?
Well, we recognize the 2-week time period. Oftentimes such types of therapeutic options require 1 or 2 week visits or interventions during that time. And really, it's a credit to the partnership that we have across our whole of government state response. Commerce, our Department of Business Regulations, Department of Health, taxation, and others are going to continue to work closely with business owners. We trust those that know that there are therapeutic needs that are in place. That's a critical option to be able to maintain during these 2 weeks, and are going to continue to work closely with ensuring that that is available for patients while maintaining the overall pause that's needed with closing gyms, decreasing the risk of spread across our state during this 2-week time frame.
Governor, I know we just got past Thanksgiving, Hanukkah, I think it's next week, Christmas is 3 weeks away. Are you prepared to tell people that they shouldn't be getting together for the winter holidays here?
I'm not saying that now, but I'm prepared to do it if I think that's what's needed. The point of the pause was to tamp things down so that Christmas and Hanukkah and such would be better than Thanksgiving, but I just don't know.
I was going to ask the doctor a question concerning the treatment. You had mentioned that if you test positive, you should take the new treatment you've been talking about. Is that across the board you're suggesting that anybody who tests positive?
There are specific populations that I reviewed that with, certain older individuals as well as people who are immunocompromised or have some form of underlying illness. So the key is to definitely know that that option is available and be able to connect with the provider. We're also expanding different mechanisms for people to be able to access this very new, very promising available treatment approach for people prior to admission into the hospital that have the specific qualifications that I've shared.